Welcome back, viewers, to Faith and Discipline podcast. Our guest today is Dr. Noman Zakir. He is gastroenterologist. Welcome, Dr. Zakir, to Faith and Discipline podcast.
Thank you.
What is hepatitis?
So hepatitis is a condition which involves inflammation of liver, and it happens mostly with viral infection, but it can sometimes happen without even viral infection. It can cause problems like initially when it starts in its one form, it can give you jaundice, and sometimes it can give you fever as well, and you can feel ill like as if you have got a viral infection, and then gradually you recover from it. So that is one kind of hepatitis that can happen. And sometimes you don't feel anything at all, just like blood pressure and diabetes. Till you test yourself, you don't know whether you have this condition or not, and that is the more difficult kind to treat, because sometimes it can get into its advanced stage, and then we can tend to find out that the patient has got hepatitis.
Okay, thanks for that. Can you briefly describe what is jaundice?
So jaundice is a simple thing, just like people get headaches and they say I've got headaches. Sometimes people say they have got fever. Likewise, people tell us that they have got yellow discoloration of eyes and skin. And sometimes even urine can get also very, very yellow or orange. So whenever people have yellowish discoloration of eyes or skin, they say they are called to have jaundice.
What are the causes of hepatitis?
So hepatitis mostly, as I said, is a viral infection, but sometimes without even viral infection, a body can itself fight against the liver cells. That's a separate topic. But viral infection, I'll just concentrate today on viral infection. So any kind of viral infection can give you hepatitis, but mostly there are liver specific viruses which mostly affect primarily liver itself and causes liver infection and liver inflammation, which can be seen or diagnosed as hepatitis, like with jaundice, sometimes without jaundice, with just blood test abnormalities. Now when this inflammation happens, you can either feel unwell. After a short course of time, you can get completely normal and virus is completely cleared from your body. But then on the other hand, there is another kind of hepatitis where you don't feel anything. The virus goes into the liver, gets embedded in the liver cells and stay there for years, causing slow liver damage, and that is called chronic hepatitis. Okay. So there are two kinds of hepatitis. One is called acute hepatitis and the other one is called chronic hepatitis. The chronic hepatitis mostly happen classically by hepatitis B, C and D, while acute hepatitis happen with hepatitis A and E. I think today we'll try to just concentrate on chronic hepatitis, which is more common and problematic issue. So we'll focus today on hepatitis B, C and D, chronic hepatitis.
Thanks for that. How is hepatitis diagnosed?
So hepatitis is diagnosed by a routine blood test. We do liver function tests, which we in normal terms call LFTs. And when we do those blood tests, then we find out that people have got abnormal liver function tests, and then we say that, yeah, you've got hepatitis. And then to confirm what is the cause of it, then doctors or GPs do viral screening for hepatitis B and C, and then if the test comes positive, then they send patients to hospital doctors like myself.
Okay. So what are the treatment options available for hepatitis B, C and D?
So hepatitis B and C are two different kinds of animals completely. So C thankfully have got full treatment nowadays by the grace of Allah. What has happened is that now we have discovered antiviral treatment which are very, very effective, more than 90% effective. Just like we have a chest infection like pneumonia, we give people 5 days or 7 days of intravenous or oral antibiotics, and the pneumonia gets completely cured and they get better. Likewise, we have treatment for hepatitis and they are called antiviral tablets and medications, and these tablets are, unfortunately, it's not as quick treatment as the pneumonia treatment. It involves around 3 to 6 months of antiviral treatment on a daily basis, that we give you 1 to 2, 3 tablets that you take every day without any holidays, and in 3 to 6 months your hepatitis C is cured. Now on the other hand, Hepatitis B is something which we cannot cure, but we can keep it under control by reducing the viral load in your body and in your liver by giving you regular daily tablets that you take on a regular basis for long term, for years sometimes. And this hepatitis B then comes under control enough so that the viral load is so less that people cannot transmit it to others, or the transmission risk is reduced. That's why I'm saying that hepatitis B is a different animal from hepatitis C, which is curable these days in present day and age in 2025. The treatment, the effective treatment, I think came into action around 12 to 15 years ago, but hepatitis B treatment has been there for more than 2 decades, but unfortunately we cannot completely cure it.
Okay. Did you mention about hepatitis D?
Now, hepatitis D is like a friend, shall we say, a deadly friend of hepatitis B actually. So if you have hepatitis B, then you have a chance that hepatitis B can on top infect your liver as well. So if you don't have hepatitis B infection, you cannot get hepatitis delta infection. D or delta is the same thing. So that's why, and the problem is that with hepatitis B, you have chronic liver damage which happens slowly over years and decades, while hepatitis delta, if the patient has got hepatitis delta also with hepatitis B, then this damage is accelerated significantly. Okay. Sometimes it happens within a decade, sometimes within 2 to 5 years actually. So it can be a devastating illness if it happens. So whenever people have hepatitis B, it is best to check for hepatitis delta also, because the consequences are slightly different.
Are there any vaccines available for B, C, or D?
So there is only one vaccine for only one kind of hepatitis, which is hepatitis B. There is no vaccine for hepatitis C or D. So thankfully, although hepatitis B does not at this point in time have cure, but we have got prevention, and which is almost like 100% prevention. So if people take 3 vaccine injections, 0, 1 and 6 months, or 0, 1 and 3 months, then they have got a long-term protection against hepatitis B infection. Usually it is given in some countries as a blanket immunization from childhood, while in some other places or in olden times it was being taken by at-risk individuals like medical professionals, and some other professionals were also given hepatitis B immunization. Hepatitis C, unfortunately, does not have any immunization available against it.
What is the success rate of these vaccines?
So it is quite more than 90% successful against hepatitis B. It is quite successful. Very, very rarely we find that a person does not mount an immunity against hepatitis B despite double doses also. But there are very, very few. I only know 2 or 3 patients in my long career that I've seen who could not mount that response against hepatitis B. All the rest they are like, it's gonna happen. If you open your eyes, you're gonna see things. So like that, if a sun comes out, you'll see sunlight. It's just like that.
Just like that. So it is more probably that it's successful. Yeah. There might be a reason. They might have other comorbidities or other health issues that might have reduced the effectiveness of those vaccines. The couple of people you mentioned.
No, I think they were quite healthy actually, but somehow they could not mount any. They did not have any HIV or any immune deficiency or any other condition like diabetes or anything else. They were very fit and well.
Okay, that's quite unfortunate. What happens if hepatitis left untreated?
Yes, so when hepatitis B or C or D is left untreated, it keeps on damaging the liver. When it keeps on damaging the liver mounts inflammation against the virus to fight it off. When it does that, unfortunately, it damages itself as well. And what happens is there are lots of inflammatory cells that happen. Then there's lots of fibrosis. It happens like that. Just like we have a burn mark on skin. Like if you burn yourself by a kettle or an iron, electric iron. And you get a bit of redness first, and then the redness and pain disappears, but you just have a white mark or a scar tissue there, which stays there for life with you. Likewise, same thing happens in hepatitis infection, in hepatitis B, C, and D, that you have acute inflammation initially, then the acute inflammation may die, but the scar tissue might remain, which does not look perfect like like the perfect liver should be. And when because of that scar tissue, there are changes in the liver which causes liver failure. Slow and gradual liver failure, and when this happens, then you can have problems like jaundice can start, like yellow discoloration of the eyes start. Then you can become confused now and then, which we call hepatic encephalopathy, or you can vomit a large vomit with blood or coffee ground, and that can be life threatening. And all of these things, and the other fourth thing that can happen is you can accumulate fluid in your tummy, which we call ascites. If any of these things happen, that is the time when we try to think about liver transplant. And liver transplant just means trying to put another liver instead of your original liver, natural liver, given by a donor, and that liver is then connected with blood vessels and bile ducts and everything, and then that liver works instead of your normal liver and can give you a new lease of life. So that means that hepatitis B, C, and D can actually cause significant liver damage, which can sometimes lead to liver failure, which may require liver transplant in 20-30 years time. The other unfortunate thing that can happen in such a patient is you can have liver cancer as well, and that can also be quite devastating. And there are other treatment options for liver cancer. That's a different topic completely, but one of the treatment is liver transplant, even in that case as well. If the liver cancer is small, consultants and the team feel that this will be the appropriate, then they offer them liver transplant.
Okay.
Not in every case of liver cancer, though.
Right. And how successful is the liver transplant? Does it work perfectly normal?
So liver transplant is a fairly successful treatment, but it is not perfect. It means that when you are taking liver from another person, that person is considered foreign to your body. And because of that, there is autoimmune, immunity against that foreign object, that liver you have transplanted. And to reduce the immune response, you have to give them immunosuppressant medication, and that has to be given for life till you need that liver.
Okay.
And that means that those medications are supposed to be given for life to that person.
Right.
So liver transplant person can be healthy, but they need to be on some treatment. Now the success that you have asked me is what we usually say is that it is around 90% successful in the first year, but 85% is the 5-year, 85 to 90% is the 5-year survival rate of most of the liver transplant in a good center, liver transplant center. So after 5 years, if you have survived that, then there's a strong chance that you will survive for a long time. So 85 to 90% is a good success rate for liver transplant.
So another question comes to mind is immunosuppressant medication you just mentioned. If we prescribe to patient, it will weaken up their immune system, and it will open doors to other diseases, and they can be easily infected with other. So how do they manage their lifestyle?
So it's what we say in our community, liver community, is that immunosuppressant for liver transplant is not a science, it's an art.
Okay.
You have to balance both things. You have to balance the need for the liver to function well, which has been transplanted, but the immunity should not be suppressed so much that they have infection. And as I said to you, that 85 to 90% of our patients survive without any problem. They lead normal lives. Okay. Sometimes you don't even know that these people have liver transplant. When you see them in the streets actually, or in your daily life, you don't know that they have had it until they tell you that.
Okay.
Yeah, so that's that bit. I'll switch gear and go towards the treatment of hepatitis B and C. So C, I think I've told you about that. It's a 3 to 6 months treatment, while B is around long-term treatment. But along with that, as I said to you, that there's no, I'm just trying to clarify, because sometimes what happens is that people forget things and they have to rewind, I guess, in your podcast to talk about it. So it's all, most of the time, hepatitis B and C in short is treatable. But if we can avoid it and we can prevent it by immunization, that's best. Now the only one thing that we have to think about is how do we prevent it other than immunization? And that's the most important thing that we should think about, because immunization comes only when something bad is about to happen. Just like, if you don't drive the car, there's a strong chance you may not get a car accident. Likewise, you see, hepatitis B, C and D is transmitted through body fluids, i.e. by injections, by blood transfusion, by unprotected sexual intercourse. These are the same risks that are for HIV as well, HIV infection. So if we try to categorize them, hepatitis B is the most transmissible, hepatitis C is second most transmissible, and HIV is even less transmissible. So, and that's just a rough guide, and I can be wrong. So there are other research scientists who would say something different, and they may be right as well in different population. But what I'm trying to say is, basic thing is, if you avoid unnecessary injections, unnecessary intravenous drips, then there's a strong chance you may not get hepatitis B or C. And this hepatitis B infection happened because in some cases those injection needles are used by different people without, these needles should be destroyed after one use, and that in some places don't happen. So that's one thing, and it happens even in West also, in IV drug users as well, intravenous drug users. So that's why we have to be careful, and that's why there is a needle exchange program in drug users, that if they can't stop their habit, at least they use a new needle every time. Because otherwise hepatitis B, C and D or HIV can get transmitted to other users of the same needle. So that's the most important thing that we have to think about. And I would suggest that all young people should get tested for hepatitis B and C actually in their young life at least. And second thing they should do, they should get is hepatitis B immunization. Blood levels should be monitored at least once in their life, because if they have received a vaccine, if we check the blood test and they've got enough antibody titer, then we know that they are protected against hepatitis B. This should be done especially before marriages, so that one spouse may have it without them knowing it, and they can then transfer it to the other spouse. So that's important that we make sure those people before marriage is tested, and if they have hepatitis, then the other hepatitis B, for example, then the hepatitis B immunization should be checked for the other spouses, so that the other spouse don't get it. And the other thing is hepatitis, if they have got hepatitis C, they should just get their treatment for 3 months before going into a marriage, so that they are cleared from hepatitis C.
Yeah, that's obviously very important. Another question related to this is, when you said fluid exchange, does it mean if someone is drinking something and they share their drink with somebody else, or even with kissing, does it transfer the virus?
No. So the fluid exchange means that if, like a sexual intercourse, have got some liquid that get transferred for one human to the other, that is a fluid exchange. The other fluid things that can happen is that if you give blood from one person and is donated to another person, if that blood is not checked for hepatitis B, C, D and other viruses, then that blood can transmit the same infection to the other person. So those are the few things that you need to think about. The other thing is, like, if technically to be 100% correct, if you have any mouth cuts in the mouth, or the mother has got cuts on her nipple, and if the baby is suckling the milk from her cut nipple and she has got a hepatitis, then the baby also has got cuts in their mouth, then this can be otherwise not. So kissing doesn't cause it, so no problem. Drinking water does not cause any problem,
because this is one of the myths in general public which needs to be
Yeah, but this can transfer hepatitis A and E. We'll talk about later on.
Yeah. Okay. So finally, what is your general advice to the public how they can look after their liver health?
So that's a very big and different topic, to be honest, because in general, what I would say is that, as I said to you, that there are non-viral reasons for hepatitis or inflammation and liver damage. One of the biggest and the commonest one is fatty liver, and that fatty liver happens in people who are overweight, which is almost 50 to 60% of our normal population, and also people who have got diabetes. So these are the 2 or 3 categories of people, which is like a significant number of normal population actually. So they have to make sure that their weight is low, their diabetes is under control. Then the chances of or the speed of liver damage might be halted a little bit.
Okay.
Or reduced. So we can talk about that, I guess, in a separate topic. But for now, I think this is sufficient, I guess.
Many thanks, Dr. Zakir, for joining me today. I believe the information provided, our viewers will find it very useful.
Thank you.
Many thanks for watching this episode. If you found this useful, you can share with your family and friends. If you haven't already, please make sure to subscribe to this channel. Thanks for watching.